Hi there, welcome to DTAS 156, Human Systems 1. This is Dr. Hilly. This video is your medical history project review video. So you've already completed the medical history project. It has been graded. And now I want to let you know how it has been graded and kind of talk to you about that grade a little bit. This takes place during final exam week in the fall semester. So you will watch this video in place of taking a final examination during that exam time. Okay, so this video is going to be twofold. The first thing that I want to do is I want to go through the medical history project grading process with you so you know exactly how your project was graded, how to access that grade, and how to see your feedback. And then the second portion of the video, I'm going to go through the actual answer key with you. And I want you to understand why the answers are what they are, and help to continue to sharpen your medical history skills and your critical thinking skills so that you're ready to see patients. So number one, let's talk about how to access your grade, okay? So if you go to the grade book on the DTAS 156 Blackboard page, and you go over to medical history project, what you're going to do is you're going to right click on the space next to, so you're going to see a numerical value. Okay, a 90, 100, whatever your numerical value is. You're going to right click on the arrow next to that numerical value, and then you're going to click on View Grade Details. Okay. When you click on View Grade Details, you're going to see a couple of things. You're going to see your current grade. You can click View Attempt. You can actually see your rubric. If you go to, if you go to column details, or grade history, it's going to show you your attempt for submitting this assignment. So when you submitted it, it is going to show you the score that you earned on the assignment. And then underneath that, there's a little box that says View Rubric. If you click on View Rubric, what comes up, let me go ahead and share my screen with you here. What is going to come up when you click View Rubric is going to be, let's get all this off so that you can actually see what's going on. It's going to be the actual rubric that was used in grading your assignment, okay? And so what you're going to see is that there are 4 criteria on the rubric, and there are 4 categories, okay? So for criteria number 1, if you identified all of the concepts correctly, if you answered you identified everything correctly under that question number 1 on your answer key, or on what you submitted as your answers, then you would get all of the points, okay? If you identified more than half of them correctly, then I check off the points in that column, okay? If you identified approximately half or less than half, I check off the points in that column. So what you can see is you can see the rubric on the Blackboard site. Now, I also had provided the rubric to you. You've been able to see this all along. I did provide the rubric to you in the assignment Dropbox, as well as you could see it in the gradebook, and you could see how you were going to be graded, okay? So here is the rubric in a PDF or in a Word document form, not in an HTML form, that you can see. So criteria number 1 corresponds to question number 1. Criteria number 2 corresponded to question number 2. 3 corresponded to question number 3, and criteria number 4 corresponded to question number 4. Okay. So if you answered everything correctly in criteria number 1, you identified what was incorrect or incomplete on the medical history, and you answered all of that correctly, then you got 5 points. If you answered more than half of it correctly, you got 4. If you answered approximately half, you got 3. And if you answered less than half of question number 1 correctly, you got 2 points, okay? At the end, what I did is I simply added up these points. Okay, so there was 20 points possible. If you got 20 out of 20, I put it down here. And then I would give you 100%. If you got 15 out of 20, I'd put it down here and you'd get a 70%. Okay. Now, what you're going to notice on your personal score sheet or grading rubric is that, first of all, in the comment section, it's going to say see answer key for comments. And I'll tell you how to access that in just a moment. What you're going to see is you're going to see a number here, 15 out of 20, 70%. And then up here on the top right, you're going to see where I have added additional points. Okay. I curved this assignment for you guys. So everybody got additional points. The numerical value that you see in your Blackboard gradebook is the value with the curved points included. Okay. And I've circled that on the grading rubric so that you can see exactly what your original score was and what your curved grade is with the additional points. Okay. So you can see that I simply went through and added up how many you got correct, and that determined your grade. When you're looking at your grade details, you can also right click and it will pull up the PDF where I scanned in your answer sheet along with my answer key. And so you are able to see exactly for each question on your answer sheet what my comments to you were. Okay. Now here's what I'm going to do. Let me move this over. Let me pull this up. Okay. I would like to show you exactly how I graded your med history. So with your med history, I gave you this medical history right here. I had you answer a few questions on it. Okay. Here is your medical history key. I gave you the questions, obviously without the answers, and then had you write the answers in. Here's what I did. Here's the key. I laid your medical history answers on my desk and I printed out a key and I put your name at the top. Okay. And then with a red pen, I went through each answer for each question. And if you had it, I put a check mark, and then I put a check mark on your sheet as well. Okay. And then all I did was at the end of question 1, I added them up. So there's 7 possible answers for question 1. So if you got 5 out of 7, I put a 5 out of 7 over here. I marked that you got more than half of the answers for criteria number 1, and I wrote individual comments for you on your answer key. So I do need you to right click and open up your answer key that I have provided for you in your grade details so that you can see the actual comments that I made to you based on your individual answers. Okay. And then that is how your grade was determined. So let's go through the actual key. Let's go through the actual med history so that you can see why the answers are what they are. Okay. So I gave you this med history and I asked you what's not complete or what's not correct on the history or the medication summary. Now, you guys, the purpose of this again is to take what you've learned in clinical science and to take what you've learned in human systems and to put those two things together and do some critical thinking for your patient. When you take a medical history on a patient, I don't know that I've ever had a patient turn in a medical history where everything is completely filled out as it should be. Okay. And so you have to really be an investigator whenever you're looking at your med histories. You need to ask questions based upon the answers that your patient gave you on the med history or based upon the areas that they did not fill out on the medical history. Okay. But your job as the dental assistant is to be an investigator, and your job is to find out more in-depth answers so that we can have a really clear picture of this patient's med history before proceeding with any dental treatment. Okay. So first thing on this med history, was what is not complete or correct on the history and medication summary. So that was criteria number one, question number one. Okay, 7 things. First thing, the medications don't match up with the medication summary. So one medication is missing from the history page. So when you go here, when you go to the first page of the history, right, they listed 4 medications that they're taking: Lipitor, Lopressor, Coumadin, and Fosamax. But on the medication page, there's actually 5 medications on there. Okay, so just we don't have it match up. They forgot to list one, so that medication was missing from the history page. Also, and some of you got this correct, and I'm so impressed with you. On the med summary, the medication for anxiety, so Lipitor, the indication was listed as anxiety. That's not correct. Lipitor is actually for cholesterol, not for anxiety. Okay. So part of your job is going to be to make sure that the indication is correct, that the client has indicated what they are taking it for correctly, and to look that up. Okay. And so some of you did catch that Lipitor was for cholesterol, not for anxiety. But that was one of the incorrect items on the history. The other item having to do with medication is that Lopressor is listed on the medication page. Okay, so Lopressor says that it is for blood pressure, but blood pressure is not identified. High BP is not documented or identified up here on the med history. Okay, so those had to do with medications and things that were not correct. Osteoporosis is not documented on this med history as well. Okay, but it should be, because again, they're listed as taking Fosamax, which is a medication that treats osteoporosis, or it is indicated for patients who have osteoporosis. Okay, so a lot of things having to do with medications. The reason that there were so many incorrect items on medications on your med history project is because that's probably what you're going to see most in clinical practice. Okay, patients forget what medications they're on. They list that they're on medications, but don't tell you that they have certain conditions, which you can tell that they have the condition if they're taking these medications, right? Sometimes they tell you that they're taking a medication for cholesterol, and it's really for diabetes, and they haven't listed diabetes on their med history. So lots of different things. There's usually a lot of incorrect or incomplete information that centers around medications with our clients. And so it's really important that you have good experience with that, so that you can best serve your clients out in clinical practice. Okay, so the medications on the med summary do not match up with the medications on that first page of the medical history. On the med summary, the medication that is listed for anxiety, Lipitor, is actually not for anxiety, it is for cholesterol. Okay. Osteoporosis is not documented, even though we've documented that they're taking Fosamax, but they did not list that anywhere on their medical history. Okay. So that would be incomplete or incorrect. And then Lopressor is listed on the medication page as well, but the patient did not document that they have high blood pressure. Okay, so all of those things. One other thing on here, the Fosamax response was not highlighted. Okay, so we would need to make sure that as the clinician, we are highlighting all responses that are either check marked as a yes or that are circled or written in. Okay. And then on this very first page, on the client's personal information page, there are a couple of things missing. Number one, the physician's phone number was not present, and most of you caught that. So that was awesome. The one that I don't think anybody caught that I want to really caution you on was the dentist's name. The dentist's first name was not present. We always have to have a first name. So if a patient comes in and they write down that Dr. Hubert is their dentist, we need to find out what Dr. Hubert's first name is, because actually there's more than one Dr. Hubert that practices in Evansville. Okay. There's actually more than one Dr. Hubert that practices at Columbia Family Dentistry. So at that same location. So we need to know, do you see Dr. Adam or do you see Dr. Dave? Okay, so we always need to have the physician and the dentist's full name present so that we know who to contact for consultations or for follow-up information. So those are going to be the items that weren't complete or correct on the first part of the med history. Again, we're looking for anything that the patient has not filled in all the way. We're looking for things that are not consistent between different pages of the medical history. And then we're looking to make sure that all yes or written in answers are highlighted so that they can easily be drawn to the attention of the supervising dentist that will be working with the patient. Okay, so next is what questions need to be asked. Okay, and most of you did really well on this particular portion. I was really impressed with your critical thinking skills on this portion. So what questions need to be asked? Anytime a patient highlights a yes response, anytime they fill in something or they write in something on their med history, we are going to be asking questions about that. Okay, we need to be an investigator and we need to find out more about what is going on with the patient. So typically, if they circle yes or they check yes, or they write something in on their med history, we're going to find out more about that. We're going to want to know when that particular condition was diagnosed. We're going to look, or we're going to want to know, are they currently under the care of a physician for it? If they are, when was the last time that they saw their physician for it? If they're not, when was the last time they saw their physician for it? And why are they no longer under the care of a physician? Is this particular condition a condition that can be reversed? Is it a condition that they will live with forever? How is it affecting their current day-to-day health? Okay, so a lot of things that we want to ask. Okay, so on here, on the med history for Carrie Smith, it looks like Carrie had a heart attack. Okay, so the first thing we want to know is when was the heart attack? And we want specifically a best guesstimate for a month and a year. Okay, so she said 6 months ago. Our answer for as a clinician is we're not going to write heart attack 6 months ago, right? Well, we're going to write heart attack May 2021, right? Or if she said it was 5 years ago, we say, okay, so it was probably around, 2016, do you know an approximate month, summer, winter, when was it? And people are going to know when they had their heart attack. Okay. They may not know the exact date, but they'll know it was December 2016, or they'll know it was February 2016. So we want to get a date. We need to know, the dentist needs to know how long ago that heart attack occurred to know if it's safe for them to receive dental treatment today. With a heart attack, anytime a patient indicates that they've had a heart attack previously, we want to know when. And our next question is there any lasting damage from the heart attack? Okay. We need to know if they've had any lasting and permanent damage that they are still contending with today from their heart attack. Because again, that could affect their dental treatment or their treatment plan. Okay, so always, if they've had a heart attack, your next question is, was there any damage from the heart attack? Okay, what else? So on this med history, they indicated that they have PAD. So we need to know what the client knows about PAD. It's okay if you as the clinician don't know what PAD is. They wrote on here that they have PAD. So let's talk about that. So we might say to the client, so Mrs. Johnson, tell me more about your PAD. What do you know about it? When were you diagnosed with it, right? If the patient doesn't know what it is either, they don't know that it's peripheral arterial disease, then we're going to have to look it up, right? But they're most likely going to know what their PAD is, when they first became aware of it, how it is currently affecting them, are they under the care of a physician, etc. So ask something about that PAD If you aren't sure what to ask because you don't know what it is, then you say, Mrs. Johnson, tell me more about your PAD. Okay. They indicated on their med history that they have a history of unexplained weight loss. So we need to talk to them about that. So, Ms. Johnson, you've indicated that you have some weight loss, recent weight loss. Tell me about that, right? So she may say, oh, I lost 5 pounds because I've been exercising and eating well. She might say, I've lost 20 pounds in the past month and I have no idea why, right? And so we need to find out some more information about that so that we know how to proceed. Also, the patient indicated that they have a physical impairment, but they didn't say on their history what it was. So we need to know what their physical impairment was. Mrs. Johnson, tell me more about your physical impairment. What body part is it? What part of your body is it affecting? Okay. If it is her hearing, if Mrs. Johnson's hearing is bad, she can only hear out of one ear. It may mean that we need to pull our mask down when we're talking to her so that she can read our lips in addition to trying to hear the sounds that we are making. If we're talking with a mask on, it can be very muffled. And if her physical impairment is a hearing problem, right, then Mrs. Johnson's not going to hear what we're communicating to her. Maybe it is a vision problem. If it's a vision problem, then we aren't going to give Mrs. Johnson a lot of pamphlets with small writing on it. We're not going to show her a lot of pictures per se, or look at x-rays where we have to look very closely to be able to see the disease process. Maybe we're going to do more tactile things with her. Okay. So depending on what the physical impairment is, will determine how we proceed with communicating with our patient and educating our patient throughout the appointment. So it's really important that we know what the physical impairment is. And then also Mrs. Johnson indicated that she had arthritis, right? So where? Is it arthritis in her knee? Okay, cool. Is it arthritis in her hand? Well, that's a different story because then we may need to modify her toothbrush so that she can better hold her toothbrush with a bigger brush instead of a small handle, right? So we need to know where her arthritis is. If her arthritis is in her hand, it's going to affect her manual dexterity. So we're not necessarily going to recommend to her that she flosses on a regular basis. We may have to find some other method for her to have proper interdental care. Okay, so we need to know where that arthritis is. Basically, we're asking about all yes questions. And all questions or answers that were written in. Okay, and again, you guys did a great job on this. So this had 6 possible answers. So I wrote your answer correct, 5 out of 6 or 6 out of 6. And then I wrote you a personalized comment. So make sure that you open up your answer key and read that. Okay. So for criteria number 3, if you go back to criteria number 3, the student accurately records a summary of the medical dental histories. This one was a big one. And this one, we had mixed things on it. Some of you were very thorough and some of you could have been a little bit more thorough. Okay, so let's talk about this. With this documentation, this is what you are writing in the chart, okay? These are basically the answers to the questions that you are asking your patient. These are the answers as you are an investigator with your particular med history. This is going to be what you found out from questioning and interviewing your client, okay? So some things that we need to think about. When we are documenting med history responses, as the clinician, we need to document a comment for every yes response or every response that was written in, okay? Always document. It's easiest if you can put it in by number. The USI medical history doesn't necessarily have numbers, so you would have to count down right? Is this question number 1, 2, 3, 4, etc.? Some other offices, the med history actually have numbers. And so you can write the corresponding number in the comment box or as you're typing it into Eaglesoft or Dentrix or whatever management system you're typing it into. Okay. Again, these are going to be answers that we found out through our interview of the client, through our questioning of the client with our open-ended questions. This box is not simply an area where you restate what they've already told you. Okay. So we are not going to restate patient had heart attack, recent weight loss, physical impairment, PAD, and arthritis. Okay, we aren't restating the question. That's a waste of everyone's time. What the dentist needs to know when they come over and look at your responses are what you found out in response to your questions. So some of these we can combine, right? Like those first two questions, are you under the care of a physician now and have you ever been hospitalized? They wrote some of the same answers, okay? So under the care of a physician for heart attack, awesome. We found out from them when they had the heart attack. So we wrote down that they had the heart attack January of 19. There is no lasting damage because we asked the patient about damage. They still see their cardiologist every 3 months and their last visit was in September. Okay. Again, it doesn't have to be long drawn out sentences, short, sweet, and to the point. They also said that they have PAD. So we listed out what PAD is, peripheral arterial disease. We say when they were diagnosed and that they take medication for it. And all we have to say is take med, see medication summary. Okay. That fourth question, are you taking any medications, pills, or drugs? They listed them there. All we need to say is see medication summary because we're going to have this, make sure this is filled out completely. Okay. All right. For number 6, they said that they were taking Fosamax, which again was not highlighted, so it should have been. We need to make sure that we comment on it. They've been taking it since 2011 for osteoporosis. Okay, they did not list that they had osteoporosis, and so we need to make sure that that's clear in this documentation or comment box. For number 12, again, we need to go through each of these areas that were marked yes or highlighted or the comments that were written in, okay? So for number 12, heart attack January of 2019, we can just put C statement above, okay? And then they can go up to number 1 and read the answer for that. Weight loss, and then whatever the patient told you. So this particular patient, I said, has lost 25 pounds since August, has not mentioned to physician. Okay, so then that's where we're going to have a comment or a conversation with the patient. So if this wasn't an intentional weight loss, definitely we need to talk to your physician about that, let them know, so they can see what's going on. For number 13, then it's the items that were written in. So arthritis, we asked them where their arthritis was. They said of the hands only. Cool. Now we know we're going to have to definitely modify some of their oral health education because they're not going to have the manual dexterity that somebody without arthritis would have. PAD, we can just put C statement above. Okay. Physical impairment, we asked them what their physical impairment was. They said that they have trouble hearing, but they can read lips well. Perfect. That's all we need to write. Okay. So in the comment box, we're writing a comment or we're writing a clarification for each yes or written in answer that was provided on the med history. Okay, the last one is what education should the clinician provide for the patient? This was probably the most missed area in the entire project, okay? The education that we are providing is based on this medical history. A lot of you put that they should brush and floss twice a day and see their dentist every 6 months. Right now, all we've taken is their medical history. We haven't looked in their mouth. We have no idea what their oral condition is. So there's no way that we can say that they should brush and floss twice a day and that they should see their oral healthcare provider every 6 months, right? We have no idea. Maybe they need to be on a 4-month recall or a 3-month recall or a 2-month recall. We don't know that yet because we haven't looked in their mouth. What we're looking at here is the med history and what education do we need to make sure to provide for them based solely on this medical history. Now, this patient, Carrie Smith, has a lot going on. And so there's definite education that needs to be provided throughout the appointment based solely on this med history. This education does not necessarily need to be provided all at the beginning when we're going through the med history. Okay, some of it may be. Some of it may be that you're talking to the patient as you and the doc are working and actually doing the procedure with the patient. Okay, that is still considered education if you're talking to the patient throughout the appointment. So things to think about. Again, Mrs. Smith said that she was taking Fosamax. She checkmarked the yes answer on that. I think it was number 6. And then through our questioning, we found out that yes, she does have osteoporosis, and she was diagnosed in 2011, right? So huge thing with osteoporosis is osteoporosis. We have to really look at bone levels. Okay, we have to really look at the condition of the bone in the jaw. And so we need to educate our patient on the possible connection of certain drugs and jaw pain, which is necrosis, and also on monitoring their bone level of their jaw to make sure that it is an adequate level to basically be able to hold their teeth in there, right? To give them so that they can have a healthy periodontium. So educating on osteoporosis and the possible connection between the Fosamax and necrosis, and just monitoring their bone level in particular. Educating our patient on the current effects of, or the possible effects of some of the current medications. Many of you mentioned xerostomia, which is good. That's not the only possible side effect of these medications. And so we need to go through them. So with low pressor, xerostomia, taste disturbances. With Coumadin, increased bleeding and difficulty swallowing. And that is a huge one, okay? Before a surgery, before a fairly in-depth dental procedure, the doctor needs to know that the patient is on Coumadin because they may actually have to do a medical consultation with the patient's physician to decide if the patient can remain on Coumadin for the procedure, if they cannot. Coumadin is a blood thinner. Okay, so basically it takes away the clotting ability. And so definitely individuals who take Coumadin have a very high increased risk of bleeding. And so that's one that we have to definitely educate our patient on. Aspirin, again, increased risk of gingival bleeding, xerostomia, Fosamax, osteonecrosis of the jaw. So we just want to educate our patient on the possible side effects of these current medications so that they can be on the lookout for them should something start to come up. Again, the patient has osteoporosis, so talking to them throughout the appointment about exercise, about increasing total body strength, which helps with their bone level, with the solidity of their bone, and with the calcification of their bone. We need to give some sort of nutrition or some sort of education on nutrition, okay, and a healthy diet. You know, talk about how the client feels about the unexpected weight loss. Have they seen their physician about it? Educating on that, right? Because it depends on what the patient says. No, they were not trying to lose weight. They've lost 20 pounds in the past 3 months. Okay, we need to educate on that right away. And especially our first point is going to be that you need to contact your physician immediately and inform him or her of that because they're going to want to take a look and see what's going on. Again, depending on what their arthritis was, there's possible education related to that. This particular patient said that they had arthritis of their hands, right? So maybe we need to recommend a powered brush to them. Maybe we need to modify a manual toothbrush for them. If they said they had arthritis of their jaw, then our education is going to be different on that as far as making sure that they are maintaining things at home and doing as the best job that they can to keep their mouth healthy. And how can we help them do that, right? So it depends on what their answer is. on what your education is, but should be some sort of education that addresses the individual's arthritis. Also, their physical impairment. There should be some sort of education relating to their physical impairment. So, do we need to take our mask off while providing education? Is the physical impairment such that a caregiver should be present when we're providing the education, because they're going to need to know this education as well, right? If their eyesight is poor, do we need to use more of a tactile sense when we're providing education? So depending on what you put as your answer for the physical impairment would depend on what the education was, okay? But there should be some sort of education pertaining to the physical impairment. So if you put an education point relating to the physical impairment, regardless of what it was, you got credit for it, right? Because what the actual education should be would depend on what you decided their physical impairment was. Same thing for the arthritis. If you put some sort of education pertaining to arthritis, you got credit for it. If you put some sort of education pertaining to nutrition and unexplained weight loss, you got credit for it, okay? So the actual point of education that I put, modified manual brush or powered toothbrush, may not be the exact answer, but what I wanted to see is that you had some sort of education pertaining to arthritis. You had some sort of education pertaining to weight loss. You had some sort of education pertaining to physical impairment, okay? I wanted to see that you were looking at the medical history as a whole and that you were providing education based on the entire medical history. Not a cookie cutter education, not come see us every 6 months and brush and floss twice a day, okay? Now, because we don't necessarily recommend that for all of our patients. In fact, we don't recommend it for half of our patients because we need to do education based on their individual conditions. This education is based solely on their medical and dental history that they have provided for us, okay? And so that's what I was looking for in this area. Again, what I did is I went through each of these. There were 6 possible education points. So I said, you got 3 out of 6. And then I marked the approximate half column for criteria number 4. I said, you got 6 out of 6. And I marked that you identified all concepts. Okay. And that's how your grade was determined. Really, you guys, I want to make sure that when you are going through a med history with your patient, that you are asking them open-ended interview questions, that you are finding out additional information than what they wrote down on their paper, okay? You need more than, yes, they have arthritis, or yes, they have a heart attack, okay? We need to find out additional information because that could affect treatment. It may be that the heart attack was 1 month ago and that is against ADA regulations and that we shouldn't be seeing them for 6 weeks or 3 months or 6 months, right? Depending on how severe the heart attack was. It may be that your patient has arthritis in their jaw and that for treatment, we need to put a bite block in there so that they're not holding their mouth open, but they're actually biting on a block and being able to rest it on there. We need to find out more about the information they provided us. We need to make sure that the information they provided us is complete. And then we need to write it all succinctly in the comment area, either on our paper, if we have paper charts, or in our management system in Dentrix or SoftDent or EagleSoft or whatever system your particular office has. We need to make sure that our notes are thorough but succinct so that the supervising dentist can come over. They can read through our notes. They can see exactly what's going on with this patient and determine if we need to make any modifications in patient treatment for that day before we can move on. And that's what's really important. This med history may be the single most important thing that you do in the office, okay? Because if we treat a patient who is physically unfit to be treated, and they should not be treated on that particular day, it is a major liability. It can have very detrimental results, okay? And so we need to make sure that we are thoroughly assessing our patients to make sure that they are physically and mentally able to be treated on the day in which we are scheduled to provide treatment. Super important, okay? Okay, so that is the answer key for your med history. Again, I went through your particular answers. I put my answer key next to it and I took a red pen and check marked off each answer that you had correct. I tallied your number correct for each section. I gave you individualized comments for each section, and then I transferred everything over to your grading rubric. Again, your grade has been curved. You can see the curve on your grading rubric, and what is found in the Blackboard gradebook is the curved total for this particular assignment. I want you to take a few minutes and look through your particular answer key, look through your grading rubric. If you have questions about your individual grade or answer key, please email those to me. Do not put them on the questions for instructor on Blackboard because that would be personal questions or personal information. So shoot me an email if you have a question regarding your answer key, but please make sure that you read through it thoroughly and you look through my comments before emailing me with questions, because I want to make sure that I haven't already answered those for you. Okay. Again, I don't expect you to be perfect on this project, which is why I curve it, which is why I curve it so drastically, because it was a very drastic curve for you guys. But I don't expect you to be perfect. We are learning right now. So I expect you to continue to improve your skills. I expect you to continue to improve your interviewing skills, your critical thinking skills, and your medical and dental history skills as we progress through the rest of the program. But this gives you a good idea of where you are right now and what you need to improve upon as we go forward for the best interest of your patients. Okay, that's all that I've got. I hope that you have a wonderful winter break. Take some time to rest, spend it with people that you love being around, eat some good food, and just take time to rejuvenate and kind of get yourself ready for the next semester. One more semester, guys, one more semester, and then you will graduate with your dental assisting degree. Okay, so we've totally got this. You're going to need some time to just kind of recharge. And so I hope that you take time over winter break to do that. Have a wonderful break, and I will see you in the spring.